continuity of care is definitely an important aspect of what we do as far as PCMH is concerned, just so that care is not pushed off to another provider and they have no idea of what's going on with our patient.
It's really important to get together so we can make sure that there's that continuity piece.
So the team huddle works by the team comes together at a designated time and we go over the plan of the day, the patients for the day.
Our activities for the day or for some time period, it can be a week or so in advance.
So it just takes place in the hallway before patient care, so you're not interacting with any patients or discussing anything that patients can overhear.
Typically in our team huddle, we will know who's going to be working with us today, as far as the technicians and the nurses, who is taken off for personal leave, for training.
Because things change every day. A provider is out, a provider calls in, a technician calls in. I tell them who they're covering for the day.
We can all miss something on a day-to-day basis, so it's really good to have your technicians there on the same page, your providers on the same page, as well as your nurses.
The huddle makes us more prepared for anticipating what those patients may require.
We all interact with the patient at different points during their visit. So items can be reinforced by multiple members of the team. If it's an item such as preventive health recommendations, smoking cessation, things like that, having it come from multiple persons can be more effective in communicating the message.
So being able to plan out the day with team huddles really helps the flow of care tremendously.
Team huddles are essential to providing holistic, safe, and quality care to all PCMH patients. They ensure that every team member is on the same page so that patients are receiving exactly what they need when they need it. Huddles also offer a forum for staff to review with each other what's working, what isn't, and how team processes can be improved. PCMH teams should have scheduled daily huddles and weekly huddles. Impromptu huddles should also be called whenever necessary.
Thank you. Good morning. Are we all here? Great. I think you all know Senior Airman Johnson is on leave this week. I believe Master Sergeant Brown is covering as we arranged last week.
Yes, I'm here to support the clinic. Senior Airman Johnson and I went over the record prep for this week's patients. We are good to go with the copy forward and Alta.
Thank you, Sergeant Brown. We appreciate your being here in lieu of your foreign functional duties.
Yes, and if you have any questions or need assistance with anything, don't be shy about asking.
All right, are there any other staffing issues, appointments, meetings we need coverage for?
Daily huddles are short planning sessions to review staffing and scheduled appointments of the day's patients and to discuss the day's workflow and respective responsibilities. Teams can also spend time in the daily huddle going over day-to-day successes and areas to improve. Daily huddle should be part of the daily workflow in the clinic. Some teams begin the day with a huddle, while others meet at the end of the day to review the following day's activities. Some teams find doing both a morning huddle and an evening checkout huddle even more effective. Huddles should be led by the provider and include active participation by all team members. It's better to over-communicate than to risk missing necessary information to optimally care for patients, so speak up even if you think you're sharing something everyone knows. However, daily huddles are also meant to be quick meetings, so it's important to stay on topic.
We do huddles every morning at around 7 o'clock. So it consists of myself, the team nurse, my 2 PAs, and our provider, our doctor.
The daily huddle is more for the team, the providers, the technicians, the LVNs, and the RNs for a specific team.
That way we're able to go over the day's patients, and then we typically go over the day after's patients as well.
Daily huddles will typically last about 5 to 10 minutes. Very brief, to the point. It's almost like a script that we go through.
We like to focus on that day's operations and plan for equipment, staffing for that day.
A lot of patients will get booked for the acute appointments. Some appointments we didn't see the day before prior to the screening. That allows us to also identify key points on each patient on any additional care that they may need or any difficulties that might come up.
Additionally, we can identify procedures or care that we're not able to provide and save the patient the visit and make the appropriate referral.
It's very important for us to go over what went well that day to see what we can continue to do. And it's also important that we go over what did not go well that day so we can work on those improvements to help the patient flow and patient care.
Because we learn from our mistakes.
At the end of the duty days, that's when we usually talk about that. We'll say, wow, today kind of got out of hand.
If we identify a shortfall ahead of time through a huddle, we have the opportunity to fill that shortfall without waiting till the last minute and encountering difficulty.
Begin the daily huddle with a review of staffing for the day. Items to address include, are all staff available? If not, what is the coverage plan? Review lunch times and coverage. Review other tasks that have to be accomplished, such as meetings, appointments, and RILOs, and review the primary POC for the team's MyCare messages. Next, review the schedule of appointments for the day. Items to address for each patient include, review the chief complaint listed. Identify whether supplies are needed, and if so, prepare them ahead of time. Identify whether labs or x-rays are required, and if so, order them in the computer before the appointment. Identify whether results have been requested for labs or x-rays, and if so, print out the results for review. Obtain results from the other provider if they're not in ALTA or CHCS. If results are not available, determine if the appointment should be rescheduled. Identify whether medications need to be renewed. Identify any patient who may present for urgent or emergent care and prepare as much as possible. Determine management of walk-ins. If the patient is active duty, determine whether the PHA, immunizations, profile, and other information are up to date. If not, follow the necessary steps to resolve. Review need for preventive services. Review referral results if available or as needed. If not available, determine if the appointment should be rescheduled. Identify patients not signed up for MyCare, and identify whether the appointment is an emergency department or urgent care clinic follow-up, and if so, obtain documentation from the facility. End each meeting with a review of the prior day, including what went well yesterday, and what did not go well yesterday that we can do better today. The majority of these checklist items rely on one of the team members having done record review of all patients with appointments, so it's important to include record prep for the next day when covering for absent team members.
I noticed that our third patient this morning, Colonel Keating, has a primary complaint of chest pain. If he is truly having chest pain, he needs to go to the ER.
I saw that on the schedule and I actually called and triaged Colonel Keating. He doesn't have a cardiac history and has no risk factors. He denied any shortness of breath, radiation of pain, numbness, tingling in his extremities. He attributes the pain to a muscle strain, which happened after some heavy lifting yesterday. Apparently this has happened to him before.
I'll have the EKG ready just in case. And according to the Huddle tool in CarePoint, it looks like he's coming due for his colonoscopy.
Okay. After we address his primary concern, I'll review his clinical preventive services with him and refer him to GI.
It looks like there's a PAP scheduled at 0900 this morning. If you need a female chaperone, just let me know. I'll be available.
And the room is already set up with all the supplies for the procedure, and the equipment is all fully functioning and operational.
Thank you. We don't want a repeat of last week's debacle with the speculum light. It was lucky we had a backup light source in the room. All right, our next patient is...
Weekly huddles should be called to review tasks that need to be accomplished for the week. One of the primary functions of the weekly huddle is team care coordination. The core PCMH team may invite other members of the Enhanced Access team to the weekly huddle as appropriate. Enhanced Access team members may include the case manager, disease manager, utilization manager, exceptional family member program staff, PharmD, physical therapy staff, and BHOP, which can be either the internal behavioral health consultant or the behavioral health care facilitator. Every member of the team must have a good handle on the team's most acute patients for huddles to run efficiently and effectively. Use the Proactive Patient Care Checklist as a guide for weekly huddles. Typically, the medical technician will independently prepare the checklist using the Copy Forward function in ALTA. The tech pre-populates all the pertinent information, which allows for a more efficient check-in process on the day of the appointment. More importantly, This checklist ensures a holistic approach to giving the patient the care they need. If the proactive patient care checklist is used consistently in weekly huddles, daily huddles would become more efficient and comprehensive.
So I think we've got that covered.
I noticed that we have a lot of diabetic follow-ups on the schedule for next week, so I invited our disease manager, Ms. Smith, to join our weekly huddle.
Perfect. Looking at the schedule next week, I see Mr. Jones coming in an established 20-minute slot on Tuesday. I need at least a half hour to 45 minutes with him to go over all of his lab work, meds, and do his diabetic exam.
I got that. I'll work with Senior Aaron Williams, who's handling the office manager duties this week. He can check the schedule, get hold of Mr. Jones, and see if we can move his appointment to the end of one of the clinic sessions. If we have any open ESTs, we will go ahead and combine one of them with Mr. Jones's appointment.
Actually, let me know when the new appointment is and I'll call him. Mr. Jones is on my disease management registry. He has not had his lab work drawn yet, so I will call him and remind him of that and inform him of the appointment. And then I'll also block my schedule off so that I'm available to meet with him after the clinic appointment.
Great. He may also benefit from a visit with our B-Hop. I'll discuss it with him during our clinic visit. What else is on the schedule for next week?
Remember, we also have a base exercise on Thursday, which may affect our staffing.
The flight chief is engaging the readiness office to see which clinic members will be participating. We should have that information today so we can plan to cover any staffing gaps.
Okay. Sounds good. Anything else we need to discuss for next week?
The weekly huddle is a 7-day look ahead where we mainly focus on scrubbing the list of patients for the coming week.
Weekly huddles are usually broader information, and we like to have weekly huddles with our elements. So we essentially bring our whole team together.
Everybody in primary care is at that meeting. So that's a great place to provide feedback and catch the doctors if I haven't been able to get them during the week.
We focus more on longer-term items such as reviewing preventive health needs of patients for the following week. We try to get our disease managers involved in those weekly huddles and also look at long-range calendar, long-range schedules.
So it's a perfect avenue with our weekly huddles to disperse information that is coming down that needs to be relayed to clinic staff.
Health maintenance type issues are addressed, so we'll order labs, routine labs like cholesterol or blood sugar, mammograms, those kinds of things. And a lot of times it's useful to get those done before the actual appointment time.
So that way everything is addressed at that appointment. It increases patient care.
We typically do those at the end of the week, and we get to review what we did well and what we didn't do so well.
So we'll look back, see how things could be improved, because there's always room for improvement with patient care. See if it could have been handled a different way, how we would handle it next time. It just helps building our continuity as a team, basically.
Impromptu huddles can be called as necessary for major care workflow interruptions, such as team member illness, no-notice exercises, fire alarms with building evacuations, and other disruptions. Use impromptu huddles to reestablish situational awareness for the entire team, update plans, and problem solve quickly during these times. It may seem counterintuitive to call a huddle during the clinic's busiest times, but making sure everyone is on the same page and knows what they're supposed to be doing will save time and effort in the long run.
Typically, we'll have an impromptu huddle during the day when an issue may arise or if a difficult patient may arise, when we need to rethink our game plan during the day.
Impromptu huddles are usually the ones that you learn the most information from. I like those because usually those come from a situation that maybe just went wrong.
I believe impromptu huddles are valuable for our team because some things slip through the cracks as far as when appointments get scheduled.
We often have patients that are booked throughout the day into acute appointments, and sometimes we have to hold an impromptu huddle to coordinate care for particular visits or particular patients.
You know, even for instance, a PCM coming into my office and saying, I'm seeing this patient, I think they may be appropriate for your services, what do you think?
And then not only that, but it allows me to discuss one-on-one with my technician and possibly my nurse if there's additional care that is required, whether AMR is needed to put a patient out of clinic and to get them to the ER.
We're always talking and always communicating about what's going on. So we almost have a continuous huddle throughout the day.
All right. We're obviously having some unexpected things happen today. Dr. Marcus had to go home sick, and I'm trying to absorb as many of his morning appointments as possible. We'll need to reschedule the afternoon appointments.
Looking at Dr. Marcus's clinic schedule, there are a few patients we can treat using our support staff protocols. 2 afternoon patients have cold symptoms, another with a sore throat, and the last patient of the day has dysuria. We may not need to reschedule them. I'll work with Dr. Marcus's techs to take care of these patients using our support staff protocols.
It also looks like there's an active duty patient on the schedule for a twisted ankle. I will engage with our physical therapy department to see if they can evaluate and treat the patient in the PT clinic.
Okay, thank you. Great teamwork. Okay, let's get our patients taken care of.